Kegel exercises are often associated with women, particularly with postpartum recovery and pelvic floor strengthening. Yet in recent decades, scientific research and clinical practice have made it increasingly clear that Kegel exercises can be just as important for men, especially in the context of sexual health and erectile function. While the idea of contracting and relaxing pelvic floor muscles may sound simple, the impact on a man's ability to achieve and sustain an erection, control ejaculation, and regain confidence in intimate situations is profound. For men who struggle with erectile dysfunction, premature ejaculation, or urinary leakage, or those who simply want to maintain long-term sexual vitality, Kegel exercises provide a natural, safe, and cost-effective strategy to regain control over one's body. To understand why Kegel training is so effective, it is essential to revisit the anatomy and physiology behind male erection. Erections occur when blood flows into the corpora cavernosa of the penis and is trapped there by constricting muscles, particularly the pubococcygeus muscle, commonly abbreviated as the PC muscle, along with the bulbospongiosus and ischiocavernosus muscles. Together, these pelvic floor muscles act like a valve that holds blood inside the penis, sustaining rigidity. When the muscles are weak, blood escapes too quickly, leading to softer or short-lived erections. But when these muscles are strong and responsive, the penis remains firm and erect for longer periods, which directly translates into improved sexual performance and confidence. One common misunderstanding is that Kegel exercises for men are simply about stopping urine midstream. While the action of halting urination does indeed contract the PC muscle, it is only a way to locate the correct muscle group. Regularly practicing Kegels during urination is not recommended, as it may interfere with normal bladder function. Instead, the proper method is to identify the muscle by attempting to stop urine once or twice for awareness, then train it in other settings. The advantage is that these exercises can be done anywhere, sitting at a desk, lying in bed, driving, or even waiting at a traffic light, without anyone noticing. Multiple studies have validated the efficacy of Kegel exercises in men. Research conducted in the United Kingdom and the United States showed that after 12 weeks of regular pelvic floor muscle training, a significant percentage of men with erectile dysfunction reported improved rigidity, longer duration of erection, and better orgasmic control. In fact, pelvic floor therapy is now considered a first-line intervention in many urology clinics for men struggling with premature ejaculation or erectile dysfunction. Rather than relying solely on medication, men are encouraged to actively engage their pelvic floor muscles, creating sustainable improvements over time. Beyond erections, Kegel exercises also enhance urinary health. Many men, particularly those over 50, experience incontinence, dribbling, or poor bladder control, especially after prostate surgery. Strengthening the pelvic floor provides a non-pharmacological, non-surgical way to regain continence. Men who dedicate a few minutes each day to Kegel training often report fewer leaks, better control, and an overall increase in quality of life. In this way, Kegels function as a dual-purpose therapy, helping both sexual performance and everyday comfort. A typical beginner routine involves contracting the PC muscle for 3 to 5 seconds, followed by 5 seconds of relaxation, repeated 10 to 15 times per session. This sequence should be performed 3 times a day. As strength improves, men can gradually increase to 20 or 30 repetitions and extend the hold up to 10 seconds. Another variation includes rapid contractions, squeezing and releasing quickly in succession to train reflex control, which is particularly useful for men who struggle with premature ejaculation. When combined with deep, mindful breathing, Kegels not only strengthen the body but also sharpen mental focus. Patience is crucial. Just as building biceps or abs in the gym requires consistent effort over weeks and months, strengthening the pelvic floor does not happen overnight. Men who expect immediate results often become discouraged. However, those who commit to daily practice usually notice tangible benefits within 6 to 12 weeks. Some report stronger morning erections. Others describe increased confidence during intercourse, while many notice an overall boost in stamina. Importantly, overexertion should be avoided. Constant clenching without relaxation can lead to pelvic discomfort or fatigue. Moderation, technique, and consistency are the pillars of success. Equally important is the psychological dimension. Erectile difficulties are not always rooted in blood flow or muscle weakness. Many stem from performance anxiety, stress, or relationship pressures. Kegel exercises promote not only physical control, but also mental mastery. By focusing on contracting and relaxing specific muscles, men cultivate awareness of their bodies, reinforcing a sense of agency. This mind-body connection reduces anxiety, creates a greater sense of calm, and allows sexual experiences to unfold more naturally. When paired with meditation, breathing techniques, or yoga, Kegel practice becomes a holistic wellness habit, uniting physical rehabilitation with psychological resilience. Clinical cases highlight the real-world impact. Men recovering from prostate cancer surgery, for instance, often face dual challenges: urinary incontinence and erectile dysfunction. Doctors now routinely prescribe Kegel training as part of rehabilitation. Those who practice diligently frequently regain bladder control faster and even report partial restoration of erectile function. This is powerful evidence that the pelvic floor muscles, though hidden and often overlooked, play a critical role in masculine health and vitality. Compared to other erectile dysfunction treatments, Kegel exercises are unique. Oral medications like sildenafil or tadalafil can provide immediate relief, but they come with side effects such as headaches, flushing, or digestive issues. Surgical options and penile implants are invasive and costly. Kegel exercises, on the other hand, are free, safe, and accessible to every man, regardless of age or medical background. For many, the best approach is a combination, using medications as a short-term bridge while simultaneously building long-term strength through Kegels. An often overlooked benefit is the intensification of orgasm. Stronger pelvic floor muscles allow men to exert more control over ejaculatory contractions, resulting in orgasms that are not only longer, but also more powerful. Some men even report experiencing multiple orgasmic waves, an experience once thought exclusive to women. This expands the narrative of male sexuality, showing that men, too, can deepen and diversify their pleasure through disciplined training. Pelvic floor strength also intersects with general musculoskeletal health. These muscles stabilize the pelvis, support the spine, and influence posture. Weak pelvic floors can contribute to chronic low back pain, while strong ones promote alignment and resilience. Thus, Kegels are not merely a bedroom exercise, but part of a larger strategy for overall well-being. For office workers who sit long hours or men who carry heavy loads, maintaining a robust pelvic floor reduces strain and enhances mobility. It is equally important to frame Kegel exercises within a broader lifestyle. Smoking, excessive alcohol, obesity, and inactivity they all undermine sexual performance. Conversely, when men combine Kegels with aerobic exercise, strength training, balanced nutrition, and stress management, they experience remarkable improvements not only in sexual function, but in energy levels, mood, and confidence. The synergy between physical fitness and pelvic floor strength underscores the principle that sexual health is inseparable from total health. Physicians often describe the pelvic floor as an invisible gym. Nobody sees the work being done, but the results speak for themselves. Kegels are not magic. They cannot solve every case of erectile dysfunction. But they are a foundational practice, an investment in long-term vitality. For younger men, Kegels serve as preventive maintenance, ensuring durability. For middle-aged men, they act as performance enhancers. For older men, or those recovering from medical interventions, they become a pathway to recovery and dignity. Ultimately, the true value of Kegel exercises lies in empowerment. Rather than relying solely on pills or external devices, men can take control of their own physiology with nothing more than awareness, discipline, and time. This shift from passivity to agency is transformative. It replaces insecurity with confidence, silence with open conversation, and fear with strength. And when men feel stronger, their partners benefit as well, fostering intimacy, trust, and connection. In summary, Kegel exercises for men are far more than a curiosity borrowed from women's health. They are a powerful, evidence-based tool that strengthens erections, enhances ejaculatory control, improves bladder function, intensifies orgasms, and contributes to overall stability and posture. They cost nothing, require no equipment, and can be practiced anywhere, anytime. Most importantly, they offer men of all ages the ability to reclaim or preserve their sexual vitality, health, and confidence. A few minutes a day is all it takes to unlock profound and lasting benefits. Kegels are silent, discreet, and often overlooked, yet they have the power to redefine male sexual health in the 21st century, turning vulnerability into strength and anxiety into mastery.